Hello, everyone. My name is Russell Leonard. I'm a doctor of physical therapy and the clinic manager here at Renew Physical Therapy in Auburn. In awareness of Stroke Awareness Month, which is the month of May, I would like to educate you and kind of empower you on recognizing some of the signs of stroke in terms of potentially saving one of your loved ones in case they do suffer from such an event. Now, the most common acronym used in the past has been FAST, F-A-S-T. It's actually been updated lately to FASTER, F-A-S-T-E-R. So the first portion, F, which means face. So what you're going to look for is someone's face, right to left. If they're having a stroke, one of the signs is a change between one side and the other. So if you have them smile and one side droops, either their eyelid or the lip of their smile, that could be a sign that they're having a stroke. The next letter, A, is for arms, which also ties into generalized weakness. So with arms, what you're looking for is if you have them raise their arms up to about shoulder height, what you're looking for is their arms stay at a steady level. Now, if they hold them at arm height and one starts to drop, that could be a sign of a stroke as well. So you're looking for single-sided weakness. Now, S is for stability. So with a stroke, what happens is a lot of times one side will become weaker than the other because the side of the brain that's affected will affect one group of muscles. So if they're having a hard time walking, if they're having a hard time keeping on their feet balancing, if they have poor coordination, another test for that is if you take your finger and have them try and reach their finger and touch their nose. So that's a coordination test that can also be done. So with any of these, if it's a sudden change, then we might be thinking stroke or be worried or concerned about that. Not if it's a gradual change, again, we have to be concerned, but if it's sudden, we're definitely worried. Now, T is for talking or for speech. So having a stroke makes it hard a lot of times to comprehend speech, to produce speech. Sometimes their words will be slurred or they won't make any sense. You could also have them try and repeat a very simple sentence, such as the grass is green or the sky is blue. And if they're having a hard time reproducing that sentence, then that's another potential warning sign. Now, last two, E, is going to be for eyes. So that is going to be vision. Now, if the stroke's affecting the back of the brain, their vision might become affected. So if there's a sudden change in their vision, such as they lose sight out of one eye or part of an eye, that again is another warning sign. What you can do is you can cover one eye, have them look at something, say how many fingers am I holding up, or ask them to read a sentence, and then swap to the other eye. And if that's something that's become much more difficult for them in a short amount of time, we definitely want to be concerned about that. Now, the last is R, and that's to react. So we want to make sure that we don't waste time when there are these signs and symptoms of a stroke, because the faster we get help, the faster and the more likely of a good outcome. So we want to make sure we call 911, we get that person to a hospital, and we take all the necessary steps to get them the help they need as quickly as possible. Now, again, if there's a sudden change in any of these symptoms, we want to be concerned. That's going to be the face, looking at the arms, looking at the stability, the speech or the talking, and then the eyes. So if there's any of those symptoms, we want to be concerned, especially if they are very quick to change. All right, I hope this has been helpful. You guys have a good day.